So I got to sit in on an evaluation down in our Annapolis clinic where one of our PTs was getting ready to evaluate somebody that was being referred from another health, wellness, or fitness provider. And in this case, it happened to be somebody who was being referred by a massage therapist. Now, it's always great to have a good network of people within synergistic fields, but I think the one thing that you really need to be mindful of is how are these patients getting into your office, and what is the expectation of the patient as to why they're coming in? Now, one thing that I've found to be very helpful is if you get a referral from a certain provider, whether it's a personal trainer, a strength conditioning coach, massage therapist, an acupuncturist, it always is great to reach out to them and get an idea of how they personally practice, what their values are, what their philosophy and their belief system is, what do they have from a resource standpoint at their clinic with regards to equipment that they can use or different treatment modalities that they like to utilize, and really get a good understanding of how they think you can best complement them. Earlier in my career, I've had more than enough instances where I've had somebody referred to the clinic that I was working at. I do my evaluation on them, and I end up doing something that looks very, very, very similar to the person they were already seeing and getting treatment from at another location. And that's something that it's kind of disheartening at the end of your evaluation. You think you do a great evaluation, you provide treatment, and they say, oh, I already do that 2 times a week with my strength coach, or I already get soft tissue work done with my massage therapist, or I've already done X, Y, and Z. I was really hoping you could have helped me out with this. Looking back on it, that problem probably could have been solved if I would have just asked a few more questions during the initial part of the evaluation. But I think what you can really benefit from when you have somebody that is being seen by another member in the health, wellness, or fitness field is figuring out how you can leverage each one another's strengths. And if you have somebody that is fitness, strength, personal training field that's referring over to you and they have a very, very strong exercise background, they're great at selecting appropriate exercises, they're very skilled at knowing how to regress, progress, or lateralize exercises based on that individual's presentation, maybe where you're leveraging your skills as a PT is identifying what those different limitations of that individual are and how that's going to influence exercise selection. So you're almost taking on more of like a consultative role as to what you think that individual's movement profile is, but more importantly, what's it affected by? Is it impaired by pain? Is it impaired by mobility? If it's mobility, is it more soft tissue? Is it more capsular? Is it just their general anatomy? Is it something more strength oriented, or is it more movement and coordination oriented? And if you can really pin that down, then you can team up with the individual that referred them to you and give them a better heads up as to how they may be able to put them in more successful environments from an exercise selection standpoint. Maybe you offer a certain treatment modality that the other referring person does not offer. So I've had that before where I've had individuals come in where they're being seen and they have soft tissue work being done by an outside provider. They have a strength coach that they like working with, but what they don't have is the space that we have in our clinic to do some of the higher level locomotive and plyometric work. Or maybe they want to utilize our BFR equipment because they're having a difficulty time increasing the overall exercise intensity without flaring the patient up or without the patient having a flare up. So there have been times where I've worked with an individual and I said, you know what? From a macro view, these are all of the things that we can work on, and these are all the different areas for opportunity. I think this area is best addressed by this provider. I think this area is best addressed by this provider. And when you're coming in for PT, we're going to work on X, Y, and Z. And then that way, the individual can still maintain their normal routine. They can still see all the people that they're used to seeing as part of their either fitness or health journey that they're on. And you're playing a more active and synergistic role with it as opposed to kind of cannibalizing everybody else's efforts. Now, the hard part about that is it does take time and it does take effort and you have to communicate with one another. But what I tend to find is if you're only working on a handful of things, you can put more effort and more time into those as opposed to trying to divide that time into everything. So the providers that you are sharing that patient or that client with, they tend to appreciate it because it's not disruptive to what they're attempting to do with them and the plan that they're working on with them. And with you, you maybe get to spend more time in areas that with a traditional patient, you don't get to spend that much time working on. And when you put all of that together, you can get some really good patient outcomes. So I think the take-home message for this is do a little digging as to how they found you and your clinic, what was expressed to them as to how you can best help them. Now, sometimes that may need to be revisited, and there may be a disconnect or a miscommunication as to why they were referred to you and what they think your area of expertise or your scope of practice is. And that's an opportunity just for educating them on where you fit into the grand scheme of things, or maybe just reinforcing what your belief and value system is to them, updating them on what standard practice is or best practices for this injury. But I think the best thing to do is just make sure that when they leave that first session, they have a very good understanding as to where they fit in the grand scheme of things and how all of the different people that are involved in their care can best leverage their time to work with that individual.